guys, this is Dr. Hub. Today we'll look at the features of the CSF rhinorrhea. So first there is something known as a reservoir sign. So what is meant by the reservoir sign? So reservoir sign in the CSF rhinorrhea, it is when the fluid which has collected in the sinus, so the fluid in sinus, it is particularly sphenoid, and it empties into the nose, into the nose. Next is there something known as a double ring sign, as well as there is something known as a halo sign or the target sign. So the double ring sign, halo sign or the target sign. So here the CSF is mixed with blood. So CSF is mixed with the blood and it is collected on a piece of filter paper, and it is collected in the filter paper. It shows a central red spot and a peripheral lighter halo. So it shows a peripheral central red spot. So there is a red spot, and in the periphery it is lighter. There's a lighter halo. Then we move on. The CSF, if you see, in case of CSF rhinorrhea, the CSF cannot be sniffed back, so it can't be sniffed back. And another point is CSF doesn't stiffen the handkerchief. So the CSF, it doesn't stiffen the handkerchief. So this was all about the features of the CSF rhinorrhea. To learn and grow daily like this, please do subscribe.